Obligate aerobes are organisms that require oxygen in order to survive. As you can imagine, these organisms seek to infect areas within the respiratory tract where there's plenty of oxygen to be found. Classically, they include Nocardia, Pseudomonas, Mycobacterium tuberculosis, and Bacillus. Pseudomonas is a really important bug that we'll spend more time on soon, so just keep this one in the back of your mind. The opposite of obligate aerobes are obligate anaerobes, which are organisms that survive only in the absence of oxygen. Put another way, these bacteria are incapable of growing in the presence of oxygen. This is because they lack the enzymes superoxide dismutase and catalase, which are antioxidants neutralizing mechanisms against the toxic compounds superoxide and hydrogen peroxide. Now, some of you might hear the words superoxide dismutase and think about a musculoskeletal disease that is caused by an enzyme deficiency in SOD1. What disorder am I thinking of? Think about baseball legend Lou Gehrig, who developed his own disease, Lou Gehrig's disease, also known as amyotrophic lateral sclerosis, ALS. Now, I bring this up to help you form a connection in your mind. But remember that ALS is not caused by a bacterial infection. SOD just happens to be common in both. So, to summarize, superoxide dismutase is an enzyme which helps neutralize antioxidants in bacterial cells. And a subtype of this enzyme, SOD1, is defective in amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. Now, SOD1 defective in ALS causes motor neurons to die. Back to the bacteria. Superoxide forms when organisms are exposed to oxygen, and in the absence of SOD, the superoxide will wreak havoc on the inside of cells. It cannot be converted into benign molecules that are safe to the bacteria. Catalase is an enzyme that breaks down hydrogen peroxide into water and oxygen. It is necessary when bacteria are exposed to oxygen to prevent the conversion of hydrogen peroxide into microbiocidal products. Obligate anaerobes include Clostridium species, Bacteroides, and Actinomyces. It is important to know if you're dealing with these bugs because they are resistant to aminoglycosides, since the drugs require oxygen to enter the bacteria. Remember these bugs with the great mnemonic, these bugs can't breathe air, for Clostridium, Bacteroides, and Actinomyces. In addition to categorizing bugs based on their oxygen requirements, we can also categorize them based on where they choose to live. For example, Rickettsia and Chlamydia get really cold living outside of the cell, so they choose to live inside the cells. And why can't they live outside? Right, they can't make their own ATP, so they must use the cell's ATP. Here's a little cartoon showing the bugs living inside your cell. And of course, there are some bugs which are more capricious. Sometimes they like to live inside the cell, but they don't have to. These bugs are Salmonella, Neisseria, Brucella, Mycobacterium, Listeria, Francisella, Legionella, and Yersinia pestis. Now these guys are summarized by the nice mnemonic, some nasty bugs may live facultatively. The F, L, and Y are part of facultatively. We'll talk more about each one of these bugs individually in the upcoming sections. Okay, time for another flash quiz. What are two obligate intracellular bacteria? The key here is the word obligate. And the answer is Rickettsia species and Chlamydia species, which must live intracellularly. Okay, on to encapsulated bacteria, which are bacteria covered by an outer capsule made of polysaccharide. These bacteria can be highly virulent because the capsule protects them from phagocytosis. People who lack a spleen, or asplenics, are highly susceptible to sepsis by encapsulated bacteria, as the spleen is an important barrier against these organisms. Do you know which are the most important encapsulated bacteria? The answer is Strep pneumoniae, Haemophilus influenza, and Neisseria meningitidis. Vaccines against these bacteria use the capsule as an antigen. Hang on just a sec. Why might people lack a spleen in the first place? Well, in the setting of severe trauma, a splenectomy may be necessary. But what are some hematologic diseases that might affect the spleen? I'm thinking of a disease that can cause recurrent splenic infarctions and affective asplenia. Show me the money. What is it? Sickle cell disease. That's right. Sickle cell patients get recurrent splenic insults and eventually can infarct their spleen completely. Wait a second. One more micro tie-in for sickle cell disease. What is the bug that classically causes osteomyelitis in these patients? Salmonella. Yes, Salmonella osteomyelitis in sickle cell disease. So on your test, you might get a vignette about a kiddo with a classic history of sickle cell, and then they'll tell you he gets Salmonella osteomyelitis. You think you're golden because you've got the diagnosis already figured out. But wait, they're going to ask you what other vaccines the kid should get. Jaws are going to hit the floor, but you've got this one in the bag because you heard it here on First Aid Express. You better make sure that kid gets vaccinated against meningitis, H. flu, and strep pneumo. Give me a fist pump. That's another question you just got right on your boards. But you're not off the hook just yet. What is the other red blood cell disorder that is commonly treated with splenectomy? Hereditary spherocytosis. Yep, in HS, the spherocyte gets destroyed in the spleen, so the only way to prevent this is to take out the spleen. Okay, so now we have an explanation of why someone might not have a spleen, and in those cases, we need to vaccinate the individual to protect them from these severe infections. Individuals with B-cell deficiencies are also at increased risk of disease by encapsulated bacteria, as B-cell immunity is the main line of defense against these organisms. Remember that B-cell immunity is antibody-mediated immunity. A little immunology tie-in here. What are some examples of B-cell immune deficiencies? Well, Bruton's agamma-globulinemia, the X-linked recessive disorder should definitely be on your mind. And what's the typical age of a child presenting with this? Well, I'm thinking of a child around 6 months in age or so. Maybe a baby boy who presents with recurrent bacterial infection. But why 6 months? Well, this is the natural decline in maternal IgG. And this reveals the baby's deficiency. Boom! Getting you points on micro and immuno all at once. Okay, so time for another flash quiz. Now we have a child with asplenia. What 3 vaccines did we just say you want to make sure you give this patient? I'll give you about a few seconds to think about this one. All right, so the answers are strep pneumo, H. flu, and Neisseria meningitidis. Remember, patients without a spleen are susceptible to infection by encapsulated bacteria, so you'll have to vaccinate them to protect against these bugs. Some organisms contain catalase, an enzyme which degrades hydrogen peroxide into water and oxygen. You'll learn more about chronic granulomatous disease, or CGD, in the biochem and immuno sections, but I want you to know that patients with CGD lack NADPH oxidase. As a result, their neutrophils cannot produce oxygen-free radicals, so these patients are highly susceptible to infections caused by these catalase-positive organisms. Now, can you remember the reaction that catalase participates in? Well, it breaks down hydrogen peroxide into water plus oxygen. Organisms which are catalase positive include Pseudomonas aeruginosa, Listeria, Aspergillus, Candida, E. coli, Staph aureus, and Serratia. Out of these, Pseudomonas, Aspergillus, and Staph aureus are the most common pathogens in CGD and are definitely the most likely to show up on your boards. Remember from immunology that T cells recognize protein antigens and then secrete interleukins to activate class switching and antibody production. So, here's our T cell. We're going to use this triangle to represent a protein antigen. This causes activation of the T cell, secretion of interleukins, and antibody production. Great. This concept is used when designing vaccines, taking a small protein subunit from the bacterium and using it to activate the immune system. When it comes to encapsulated bacteria with polysaccharide antigens, however, the polysaccharide antigen, which we'll represent with a circle, can only activate the T cell to cause IgM production. But remember that IgG is the most important opsonizing antibody. Therefore, conjugating or linking the polysaccharide antigen to a protein antigen, which we'll show here, now our two antigens are linked. This causes activation of the T cell, secretion of interleukins, and IgG production. These interleukins induce B cells to then class switch and then produce an IgG against the polysaccharide. This is how vaccines for strep pneumo, H. flu, and Neisseria meningitidis function to produce protective immunity. Urease is an enzyme that catalyzes the hydrolysis of urea into carbon dioxide and ammonia. This characteristic of H. pylori, the bacterium seen in this image, allows it to survive in the stomach because the ammonia neutralizes gastric acid. It also forms the basis for the urease breath test as a diagnostic tool. A bit more on this important GI correlate. In the urease breath test, patients swallow radioactive urea, CH4N2O, and we'll denote the radioactivity with an asterisk there on the carbon, which is then going to combine with water to form ammonia plus carbon dioxide. Now, note that our radioactive carbon is present on both sides of the equation, so all we need to do is detect that radioactive carbon, and that confirms the presence of urease-producing H. pylori bacteria in the stomach. Other bugs that have urease include Cryptococcus, Proteus, Ureaplasma, Nocardia, Klebsiella, Staph epidermidis, and Staph saprophyticus. The most important ones to remember are Proteus and H. pylori. Proteus will come back again in the renal chapter, but let's do a quick correlation here. What type of stone is formed in Proteus urinary infections? Struvite stones. What is struvite? Well, struvite is another name for magnesium ammonium phosphate, and it precipitates in alkaline urine. Species like Proteus will cause alkalinization of urine and therefore cause precipitation of struvite and formation of these stones. And what do these stones look like under microscopy? Well, the crystals anyway. Let's try this another way. Is it A, this type of crystal, B, this type of crystal, C, this type, or D, this type? Great. So what have we drawn here? The answer is C. Struvite stones, or magnesium ammonium phosphate stones, look like a coffin lid. I like to remember it with the M of MAP right here on the coffin lid. So magnesium ammonium phosphate stones. Well, what were some of the other ones? Well, this is our calcium oxalate stone, cysteine stone, and uric acid stone. Use this little visual cue to remember these facts. Pigment-producing bacteria produce a unique pigment when they are grown on agar, which aids in identifying them. Actinomyces israelii can be distinguished by its yellow sulfur granules, seen here. Staph aureus has a yellow or gold pigment, which you can see on the left, right there in that colony. Hopefully you can appreciate that it's golden in appearance on your computer. Pseudomonas has a blue-green pigment, which you can see on the right, here. Serratia marcescens has a red pigment. I want you to note the pinkish hue here. This tends to show up on your board exams. There are some helpful mnemonics in the book to help you remember these. All right, time for another flash quiz. A patient has a draining abscess of the jaw. Microscopy reveals yellow sulfur granules. What organism do you expect to find? I hope you're thinking of Actinomyces israelii. Okay, next topic is bacterial virulence factors. These features are important ways that bacteria avoid being cleared by our immune system. Staph aureus contains protein A, which binds the Fc region of antibodies. So here's our stick figure of an antibody. Here's the Fc region. So protein A binds here, and this actually causes opsonization and phagocytosis to become impaired, since macrophages and neutrophils normally bind to that region. They won't be able to get through because it's blocked. Several organisms can cleave IgA antibodies using IgA proteases, which eliminate our primary antibody method of infection clearance in the respiratory tract. These organisms can be remembered by the SHIN mnemonic, which stands for strep pneumo, Haemophilus influenza, and Neisseria meningitidis. So strep pneumo, H flu, and Neisseria meningitidis. Remember also that all of these organisms are encapsulated. M protein is strongly antiphagocytic. We will encounter the importance of M protein again when we talk about group A strep and rheumatic fever.